So welcome back everyone to the final part of our virtual taster day with the NHS today. So it's been a great day so far. So thanks again students for your input in the interactive sessions, but now is the opportunity for you guys to ask your questions. I know there's been some great questions asked throughout the day already, but this session is to ensure that we can cover any final questions that you guys might have. So we've got a few familiar faces on the panel, joined by a new face as well. Who I will introduce you to shortly. But students, do give us a hello in the chat box so I know you are with us. And also just to remind you of how you can ask your questions. So the chat box is there for you guys to use and for any comments, which you guys are doing now, which is great. But please do direct your questions in the Q&A box, just so we can make sure that we can see them and they don't get lost and we can get through them all. Perfect. So let's hand over to our panel, and guys, do keep the questions coming in for this session. So I see that we have a new face with us. So Steph, let's come to you in terms of who you are and what you do at the NHS.
Hello everyone, my name is Steph Davey. I'm a practice education facilitator for nursing associates and also now nurse degree apprentices. We work at West Herts, and that's an acute trust, so we cover 3 different hospitals. My background is very varied in nursing, so I started off in an acute paediatric hospital. I've also worked in community and I've worked in research as well. And now I'm working in education, training the future workforce. So if you have any questions about the NA programme in particular and about working at an acute trust, then I can hopefully answer any questions.
That's great, and I'm sure we will. Thanks, Steph.
You're welcome.
Remind ourselves, I know Caroline and Meldrick, we met you earlier this morning, but Caroline, let's start with you first. It'd be good to give us a reminder of what you do as well, please.
Yeah, so I'm Caroline Holmes, Student Nursing Associate Pipeline Manager. So as Stephanie just said, the Nursing Associate role comes under my remit, but for the whole of Herts and West Essex. So that covers the area where Steph works, which is West Herts Hospital Trust, but it also covers Lister Hospital in Stevenage, PAH, Princess Alexandra Hospital in Harlow, and we have Community Trust, Mental Health Trust, 3 hospices, and also we've included primary care, GP practices and social care, just starting off really with nursing homes. So my background is a nurse. I'm an adult nurse and have various experience in community, mental health and acute trust nursing. And I've been with the NHS for about 35 years now. And so this is a relatively new role, the Nursing Associate, but if there are any questions from this morning's session, happy to answer them.
That's great, thanks Caroline. And Meldrick, a reminder into where you're focused within the NHS, please.
Good afternoon, everyone. My name is Meldrick Magsino. I'm one of the practice educators from the East and North Herts NHS Trust. My main role is to support student nurses in placement and at the same time new registrants practice who are called preceptees. Part of my remit also is to engage with schools and universities as to how to recruit interested students in the nursing profession. So yeah.
That's great, and the questions are already coming in, so let's have a look then. Right, so let's start with this one. Is it possible to do an apprenticeship for becoming a doctor or surgeon? If there is, how can I apply and where is the best place to apply? I don't know who's best to answer that one.
I don't mind trying to answer that. Obviously my background is nursing, not medicine, but there is talk, I don't know whether Steph or Meldrick, you can confirm this, but about doing having an apprenticeship for medicine. I'm not quite sure when that's going to start, but the best place to look is Health Education England, their website. I think I'm not sure if Rebecca's on, but Rebecca might be able to let me know more about that through the Health and Care Academy website, which she provided the link for earlier. It's probably in its early stages yet, but I know definitely for nurses, there's advanced nurse practitioner roles, and of course there's GP advanced medical roles. So there is quite a lot going on with apprenticeships. So as I say, Health Education England is probably the best place to look, because they have all the information about apprentices. And also if you type in apprenticeships, it'll take you to the website from gov.uk about various apprenticeship roles that are available throughout everything, not just healthcare. I hope that answers the question. Don't know if anybody else wants to add anything of what they know.
Caroline, that's great, thank you.
Should I just add on to Caroline's? Actually, I think I mentioned in one of the breakout rooms earlier. So I think, as Caroline said, there's been talk, I think, quite a lot in the press recently around apprenticeships for doctors. I don't think it's there just yet. But it's what we have got in the Academy is a really great webinar that was recorded for one of the junior doctors. And I'll pop the link in the chat again, just to make sure everyone's got it. Who I think he talks for 2 hours about his career into medicine and how he got there and the pathway and the different routes. You can do it. It's a really, really great worth a watch if that's what you're interested in. There's a few of them as well. So if you are interested around nursing, there's one for that. There's one for social care, nursing associates. And there are some more coming up as well. So there's a psychology one coming up as well. So I'll pop the link to those webinars. If you are particularly interested in medicine, definitely recommend that one as a watch, because I think we've kind of focused more on nursing and social care today. So I recommend that.
Of course, great. Thanks, Rebecca. And I think the website might be able to help. Someone has asked, is there a website you could link for the nursing associate? So is that the same website there? Caroline's nodding her head. So guys, do make a note of that. Sam has just, I think, yeah, Rebecca has shared that. We'll make sure that you've received the link as well as a follow-up after today. So do not worry. Great, right, let's have a look at more questions that are coming in, which is fantastic. So we have spoken about work experience earlier, and I remember Nicole mentioned there's loads of online virtual resources, but someone has asked, after the lockdown rules ease, how can you get work experience? And I think they might mean physical work experience. I don't know if anyone can expand on what that might look like.
I mean, I think it's worthwhile just contacting local NHS trusts in your area, because there are teams that deal with that voluntary work and work experience. I think you can set it up through your own school. There should be somebody within the school or college that is responsible for setting up work experience. I just know from my daughter, when she did, she's gone on to do a midwifery training and did work experience in the maternity unit when she was still at school, and that was arranged through the school. But it's worth contacting the NHS trust, you know, where you want to work, just to find out, you know, what the options are.
I also sorry on that as well, Caroline. So yeah, and I think most of our organisations in Hertfordshire, West Sussex, well, all of them, they'll all be suspended at the moment in terms of offering work experience, just because of COVID, and hopefully in the next few months, as the situation continues to improve, we'll be able to re-offer some of those placements again. We do have a central portal, so we were in the process of launching that last year, so we've got some of those live. So depending on where you work, where you live and go to school, we have some placements already up there, although you can't apply for them at the moment, but there'll be more added. So we're trying to make it easy for you to access work experience and being able to apply. But I think all things like this count at the moment. So universities, applications, they'll take all this stuff into account. They realise that you cannot go out onto a ward at the moment and do work experience in the same way you would have 2 years ago. So all these things count. We've got virtual opportunities on the website as well. So e-placements that are, have videos and quizzes and games. All those things count. The universities are aware that what you can and can't do at the moment. So definitely take advantage of those, and we're hoping to add some more virtual work experience offers over the summer as well. So keep an eye out for that, and it will all be on that website on the work experience page that I've just sent with the career conversations as well.
That's great. Thanks, Rebecca. And remember, guys, of course, you've taken the time out of your Easter holiday. So as Rebecca said, you do talk about today as well. And thanks, Nikki, for sharing all those links. We'll make sure that students get those. I saw a question in the chat box, and Steph, I think I'll come to you. It's around apprenticeships. So how available are the apprenticeship programs, and how might students go about applying for them?
So at the moment within our trust, we're internally recruiting, and that means you come to the trust as a healthcare support worker, and you do basic training in patient cares, which is called the Care Certificate. So that's a national program. And once you've got those basic cares, you can apply for the apprenticeship program. And you need maths and English level 2. And it's a fairly straightforward process once you're in the trust. We're now currently looking at how we can expand that to external recruitment as well. So again,
That's okay.
So these opportunities are directed through a Health Academy website. So expression of interest will go through there from people that aren't employed within the trust, and we'll receive them and process them and put them on our list for the apprenticeship programs.
Great.
Can I just say about the Health and Care Academy website and expression of interest form? Thanks, Stephanie, for saying that, and that's absolutely right. And when we opened, at least the Nursing Associate page was set up by Rebecca and Nikki on the Health and Care Academy website, and we had quite a high number of expressions of interest from people externally, and also people working in healthcare, which I've responded to directly. There's also the Nursing Associate pre-study course. It's not really a course, but it's a one-day session just to give information to people that are interested in the role, to give them a bit more information. So they're run monthly virtually via Zoom. They're from like 9 to 3, I think, on a Thursday or Friday afternoon. I think those are, if I'm not wrong in saying, Rebecca, there's a link there to that on the Nursing Associate page on the Health and Care Academy website.
Sorry, Caroline, I missed that. I was just typing a response.
Yeah, no, sorry. I was just going to say about the University of Hert's pre-study day.
Yeah, so they're all linked. So on the Nursing Associate page, which I think Nikki's just dropped in, there's a link to the University of Hertfordshire pre-study course, and all the information there you might need to see, and the case studies from a couple of the Nursing Associates I think Caroline talked about in her breakout rooms, and how their careers progress so far, and then their next steps as well.
I just wondered, Catherine, there's quite a good one there. There's one about how many years at university is it to be a neonatal nurse. I don't know whether, Stephanie, with your experience, you might be able to answer that from children's. Sorry to land you with that.
No, that's okay. So it's 3 years for the qualification, and that, so you'll be pediatric specific, and then there's other courses that you can do afterwards to become specialised in neonatal. But a peds qualified nurse can work in neonatal units.
Great.
And I don't know whether somebody wants, or I don't mind answering it, but about decisions about funding in the NHS, which comes from the government initially, about funding and how it's distributed and what the key areas are. You'll probably, realise that mental health is a big thing, and probably always has been, but maybe not funded as well as it could have been. There's definitely a focus on that, and social care, which is, residential care homes, nursing homes, social care for people visited at home, who need care at home. And really the emphasis, as I said this morning, should be to try and keep people at home as much as possible, and to have wraparound services for them, either from district nurses or from social care agencies. Social care is still quite underfunded, in my opinion, and still needs a kind of bit of a boost, really, because carers that provide that care are really up against it. There's a lot of demand for it, so that comes from government, and they'll sort of say this, it needs to be spent on this, but individual trusts and hospitals or GP practices do have a say in how that budget is allocated. I hope that answers that question anyway.
Thanks, Caroline. Don't know if anyone else wanted to expand on that. I did see something in terms of training. So once, say, you have become a qualified nurse, if you wanted to get into becoming a surgeon, what does that look like? I don't know who can answer that one in terms of the transition and I guess the top up that would be required.
I don't mind giving it a go, but I think it's great to have career progressions. You obviously need the relevant, you know, professional development points to be able to get into university, to top up to study medicine from nursing. I think you would probably, I don't know whether Stephanie or Meldrick you'd agree, you'd have to go to the level of advanced practitioner within nursing before you could possibly proceed to become a surgeon or a doctor, study medicine, but it certainly would count in what they call CPD points. And again, it might be worth looking on the universities that, you know, hospitals and universities that currently provide medical training, what the routes are into that from nursing. But there's some very good roles within nursing, the advanced clinical practitioner, who is kind of almost at a level of a junior doctor and can do very many of the roles that they can do and the tasks that they can do. So I would emphasize that nursing has developed so much and there's so many career opportunities that it's great if you want to go into medicine, but, you know, just consider at first that there are a lot of opportunities within nursing.
Great, thanks, Caroline. Meldrick, I'll come to you on this one. In terms of work experience has been, you know, lots of students do worry about that and not having enough work experience. So I wonder how much is usually looked at for when applying to nursing at university?
Actually quite puzzled with the question because I think universities vary upon on the academic qualifications, which we discussed earlier, the common entry requirements to get into the profession. I think for work experience, so far I haven't, probably depends on the road that they wanted to take, whether it's the general nursing degree or they want to try apprenticeships, for instance. Perhaps that has been misconstrued, like when you're working while studying. So that's a different route as compared to the general university route. But for example, I've encountered student nurses also who are in a different program that they have previous work experiences before, previous degrees perhaps. They're at a master's level degree and they're in a compressed nursing program for 2 years. So that's another option. Sometimes we get students who are already working before as professionals in different fields and they decided to get into nursing. Their previous learning will have to be checked and which areas will need some sort of top up so that they can complete the degree. But for as much as I know with the general nursing route, they don't usually require that you have, as long as you have the entry qualifications and you pass their screening processes, then you can apply for the course.
Great, thanks. And Meldrick, I'll stay with you for this one. I know in terms of the requirements, obviously, as long as you have maths and English GCSE, and sciences can be an advantage. And just to, could you please confirm the requirements around A-level science, or obviously it depends on what you're applying for. Yeah. If you can give some advice on that, please.
Usually it's 2 to 3 A-levels or equivalent. I highly suggest that it's around the areas of biology, chemistry is also another thing. because the integration of biology and chemistry when we treat patients. Psychology also is pretty helpful around those areas. Life sciences definitely would be my recommendation. Yeah. Human biology. Yeah.
And I'll open this up to the floor for, what advice would you say for those students who are perhaps on the fence with whether to pursue nursing down the apprenticeship route or the university route? Are there any tips that you would give to students? I don't know who wants to, if anyone has anything that they would like to share.
I can start. Yeah. Regardless of what route they decide to take in the nursing profession, I think it's really important for you to learn personally how to manage your time, because you'll encounter, of course, you expect to encounter challenges during the process as to balancing between, for example, if you're on a general degree, you're balancing between working on your assignments in the university at the same time having placements at such critical climate at the peak of the pandemic. If you are choosing the other routes, which is nursing associate or apprenticeships, you get clinical experience, which will broaden your horizons in nursing profession, and it will give you the feel of what it really is, what it entails. Again, at the same time, you have to deal with the academic requirements of the course, which can be quite a challenge. But then, despite all these challenges, the NHS, studying to be a part of the NHS, you'll receive definitely a handful of support. There's lots of support available for students, and both from universities and from practice placement partners like trusts. So yeah.
Great. And Caroline, I think it would be good actually if you could please explain maybe the difference again, just to remind us around the nursing associate, and then how that is different to becoming a registered nurse through the degree apprenticeship, if that's okay, please.
Yeah. I think, as I spoke about before earlier, the nursing associate was introduced. It's a relatively new role, started in 2017 as a pilot phase, and has been developed since then. But the idea was to bridge the gap between healthcare support workers, who, although are very skilled, very helpful, and their role is absolutely vital, from that to jump to a registered nurse, there's not really anything in between. So the nursing associate has undertakes a foundation degree, as Meldrick said, learns skills and knowledge on their practice placements as well as the theory element, so that they kind of can progress from a healthcare support worker, become a qualified nursing associate. They're registered by the Nursing and Midwifery Council, so they're regulated. The role is regulated in the same way that a registered nurse would be. And they can take on many of the tasks, not all, but many of the tasks that a registered nurse can take on. So you've got that kind of autonomy, independence, if you like, and you do need some supervision as a qualified nursing associate. But I think it will be shown on, if you look at the Health and Care Academy website, from our testimonials from qualified nursing associates, one of whom works in the renal dialysis unit at the Lister Hospital, and she is responsible for putting patients onto dialysis, doing their monitoring, blood pressure, temperature, pulse, whereas a healthcare support worker wouldn't necessarily have those responsibilities. So from then on, it's a career progression. You can do a year, what they call about preceptorship, which is to gain more experience once you're qualified as a nursing associate, and then you can do what's called the top up, which is another 18 months, and then you become a registered nurse. So it's a career pathway, but the qualified nursing associates that we have within Herts and West Essex have opted to stay in that role because they found it's given the job satisfaction that they perhaps wouldn't have got if they stayed as a healthcare support worker. They've got many of those responsibilities, which kind of stretches them a bit more. and the world's your oyster. You know, you can work in various areas, whereas healthcare support workers would probably more likely stay in one area. You know, not necessarily, but would need more experience if they moved into another areas. Whereas nursing associates, getting that practice placement on the course means that they can go into work in a GP practice because they'll have worked getting experience in a hospital setting, acute hospital setting, in a community setting, in mental health, in learning disabilities. So those are all the on children's. So those are all the areas that, you know, you wouldn't necessarily get if you stayed working as a healthcare support worker. So it's kind of bridging that gap. And the good thing, I think, is that it's done through the apprenticeship scheme. You're employed initially, as Steph said, as a healthcare support worker. You gain your experience. You then, the apprenticeship levy, you can pay for that person's training. That organisation can pay for that person's training. They do the training, complete it, and there you are. You're a qualified nursing associate, but you get the experience, theory and practice, and you've got an apprenticeship and a foundation degree at the end of it. And it does allow you to progress your nursing career, and, you know, from then on to go on to whatever you want to study at a higher level.
Thanks, Caroline. And I can see, Steph, you have your hand raised there.
Thank you. Just following on from Caroline as well, is to point out that the nursing associate program is a generic program. So as with nursing, the full course, you would obviously choose your speciality, being it adult, pediatrics, mental health, learning disability. The nursing associate program at the minute is generic, so you get all of that experience, and you have placements in all of those different areas. And we currently in our trust, for example, have nursing associates working medical and surgical wards, but also in A&E, as well as the pediatric department and the maternity department as well. So it just shows that, you know, you can really get a feel for the different specialities and then choose where to work afterwards.
That's great.
And I don't think we talked, just to touch on the registered nurse degree apprenticeship, that is a direct route into a higher degree, but through the apprenticeship route. So again, it's being employed, funded for the course, the registered nurse course, through the apprenticeship levy. I'm more concerned with the nursing associate role, so I don't know whether Meldrick or Stephanie, you have more information about the RNDA registered nurse degree apprenticeship.
Currently, we're only offering the top up. We're setting up our 4-year program at the minute. So
yeah.
At the same time, our trust also has that top up. Some of our RNAs are in that program, and they're having their placements at the moment alongside this the other students. Yeah.
I mean, I think if you look at the registered nurse degree apprenticeship, it's a direct route in, but you still get funded for it. Whereas the nursing associate role, you start off as an apprentice, you do the course, you then can choose to be a nursing associate, remain at that level, or do the top up, as Meldrick said, after your year's preceptorship, and then qualify as a registered nurse, hopefully, if all goes according to plan. So that's kind of how it works. I have to say, when I came into this role, I found it quite confusing with all the apprenticeship roles. I mean, it's great to have the apprenticeship routes, but and there's options. I think that's the thing. There's choice for people to say, I've got A levels, I want to do nursing, but I can't fund myself. So if I can get employed and go through the apprenticeship route, then that'll be better for me. Or I want to just start off, well, not just, but I want to start off as a nursing associate and then develop into a registered nurse through those career pathways. I mean, a lot of this came about because funding for nursing courses, particularly the student nurse registered nurse course, had always been funded. Fees were, you didn't pay fees. There was a bursary available. The government took that away. So of course now it's looking at other apprenticeship routes, how they can get people encouraged to go into nursing.
Yeah, Definitely. And I've just seen the time. We can spend all afternoon talking about it, but just to, you know, wrap up the session, it's been great. Thanks, Steph, for joining us as well. And thanks, Meldrick, Caroline, and Rebecca for sharing some really great advice. And students, you know, there is a lot of information there. Some of you have asked about pharmacy. Rebecca has shared some useful links to help you with that research into there. And Rebecca, I don't know if you want to say anything as a wrap up.
And really, it's just to say thank you for everyone joining us. I know in the Easter holidays, I'm really impressed at how many people have joined and just joining in, asking questions, asking us difficult questions, and hopefully we've been able to give the answers to some of those. Hopefully people have found it useful. Do use the Academy website. There's loads of information on there, and it's got our email address. So if there's something that you are really looking for and can't find, drop us an email, and we can see if we can either signpost you, or we can let you know when things are coming up. I've seen quite a lot of people asking about psychology, and I know there's a psychology career conversation being planned for later this month. So that I'll be able to answer the questions around psychology, because there's 350 roles. It'd be impossible to have somebody who could answer every different type of career on these sessions. So yeah, the website's got loads of information, and do get in touch if there is anything you're looking for and can't find. And just thank you for joining us. Thank you to the panelists and the guest speakers for earlier today. I think it's been a great session, and enjoy the rest of your holidays. And
yeah, thank you everyone for joining and for your question. It's been great. Thank you, Catherine, for facilitating.
Thank you. Good luck, everyone.
Thank you. And students, we really appreciate your feedback. So I have shared a link in the chat box. So please do share with us how you found today. And thanks again for turning up in your Easter holidays. And we will follow up with you after today. But you can email us if you have any further questions. Email us at student@pathwayctm.com. We are here to support you with your next step after school and college. So do reach out to us and we can help you. So thanks very much and enjoy the rest of your Easter holidays.
Bye.